New Jersey Medication Training Standards and Practices. Acknowledgements. This module, Medication Training, was developed and produced with support from the New Jersey Division of Developmental Disabilities, DDD. This module is part of the Community Services curriculum. It was developed originally in 1989 and revised in 1997, 2000, 2005, 2006, and 2014. In 2017 and 2018, the New Jersey Trainers Work Group reorganized and reformatted for use and compatibility the DDD-approved 2014 version, 6th edition, of the curriculum for use within the College of Direct Support, CDS system. Content was not changed. This curriculum provides all of the training information necessary to complete the required DDD on-site review and testing components of Medication Module. CDS Lesson 0. CDS Introduction to Medication Support. Introduction. After completing this lesson, you will increase your understanding about medication, categories, symptoms, considerations, 6 rights. Introduction. Safety, health, advocacy, independence, personal values. Introduction. The health and safety of the individuals you support is your priority. Some individuals with developmental disabilities are capable of taking their medication independently. Others need staff assistance and support. This module will provide you with the help you need to give assistance and support. Agencies cannot use typical everyday procedures. For example, most of us take medication without using formal rules. When a medical professional prescribes a medication twice a day, we take it in the morning and evening, often not at exact times. We can decide to take that risk because we are taking our own medication. However, programs involve many different staff, individuals with developmental disabilities, and sometimes families. The more people involved in this process, the more risk for errors. This is why there are a consistent set of rules and procedures to follow. You need to know these rules and procedures to lower the risk of errors. In addition to protecting the physical and mental health of the individuals you support, following these procedures will protect you and your agency from errors that could have serious health and legal consequences. Important concepts to keep in mind. Safety. Many of the individuals that you support will need medications that you may not be familiar with and may be potentially dangerous. Any medication can be extremely dangerous if taken incorrectly. There are rules in place that you must follow to make sure that the individuals receive the medication exactly how it has been prescribed. Health. Medications may be taken for many different reasons and for different lengths of time. Regardless of the reason or how long a person takes medication, the purpose remains the same: to support the individual, physically and emotionally. Advocacy. It is important that staff advocate for the individuals. Advocacy includes observing and immediately reporting any change in the person's physical or mental health. Advocacy also includes speaking to healthcare professionals about ways in achieving the individual's health goals while also being respectful of the person's choice and normal routine. Independence. It is extremely important that the individuals you support are involved in all areas of their medication process. Their knowledge, for example, in going to the doctor, getting their medication, understanding what the medication is for, etc., will lead to greater independence and participation. Personal values. It is important that your personal values regarding medication do not interfere with what the individuals you support need for their physical and mental well-being. Defining medication. Medication or medicine is any chemical substance intended for the use with medical prevention, diagnosis, cure, or treatment. Medication must be approved by an individual's doctor, licensed medical practitioner, physician, advanced practice nurse, with the appropriate signed documentation. Kept locked for those who do not self-administer. If sharing a home or room, etc., with someone who does not self-administer, the individual should have their own locked box. Documented by staff when given. Categories of medications. Prescription medications. Prescribed by a licensed medical practitioner. 1. Controlled medications. 2. Non-controlled medications. Over-the-counter OTC medications. Medications available to the public without a signed order. In our system, these require written prescriber's approval before being given. Either may be prescribed on an as-needed basis. Categories of medication. Medications are divided into two categories. 1. Prescription medications. This category includes all medications that must be prescribed by a physician or advanced practice nurse and dispensed by a pharmacist. Prescription medications can be broken down into two subcategories. A. Controlled medications. Controlled medications are medications which have been legally designated controlled substances. The medications in this category are considered by medication control agencies to have high potential for abuse. Examples might include narcotics, such as Percocet, certain medications prescribed for sleep, certain anticonvulsants, and/or certain psychotropic medications. Your agency may have special reporting and storage procedures for all controlled medications. Some agencies double lock controlled medication. Check with your agency for specific policies. B. Non-controlled medications. Non-controlled medications include all prescription medications that do not appear on the list of controlled substances. For example, antibiotics, such as penicillin. 2. Over-the-counter OTC medications. OTC medications include any medication that can be purchased without a prescription. Common OTC medications include pain relievers such as aspirin and certain cold remedies. According to licensing standards, a statement from the physician regarding the usage and contraindications of over-the-counter medications shall be available for staff reference and use and shall be updated annually. A common way to meet this requirement is to have an over-the-counter medication orders for use as needed form in place. This form lists various symptoms and then what medication can be taken and how it should be taken. This form is signed by a prescriber and is good for 1 year. This form may also be called a standing order form. You may also have an individual prescription for an OTC medication that needs to be taken routinely. The procedure for administering as needed medications will be covered in another part of this training. It is important to know that in our service system, we cannot administer any medication, prescription or over the counter, without a prescriber's written approval. Safe administration. The following areas will be covered throughout this medication module. Your agency will have many additional policies you need to follow. The medication cycle. Observe for changes in physical and behavioral signs. Report changes verbally and in writing. Assist with visit to the doctor. Get and store medication. Document all medication, medical information. Administer medications and document. 1. Observe for changes in physical and behavioral signs. Look for both physical, cough, limp, bruise, etc., and behavioral, tired, upset, quiet, etc., changes. 2. Report changes, verbally and in writing. Tell the right people about the changes you saw. Tell them as quickly as possible, depending on how serious the problem is. Document the changes you observed. 3. Assist with visit to the doctor. Support the individual at the doctor's office and/or pharmacy. Make sure all information is documented. 4. Get and store medication. Medication may be delivered or picked up and must be stored according to procedures. 5. Document all medical information. Be sure to write down all new or changed medical or medication information in all the right places, such as a medication sheet and log or communication books. 6. Administer medications and document. Administer the medication that the individual is prescribed and document what you gave. 7. Continue to observe for changes in physical and behavioral signs to see if the medication is working correctly or if there are any problems, allergies, unwanted effects, etc. Observation. Your responsibility. 1. Know the people you support so you will notice anything unusual. 2. Be observant. 3. Ask questions. 4. Report what you have seen according to your agency policy. 5. Offer whatever assistance you can as per agency policy, prescription, and/or medical advice. Observation. Since we cannot feel another person's pain, and because people with developmental disabilities may not express pain in traditional ways, it is extremely important that we pay attention to even the slightest change so we can offer help. Example, rest, medication, heating pad, etc. Through observing body language and asking questions, we will have a better understanding of what the individual is experiencing. Think of the people that you support and their communication. Sometimes people may communicate pain or discomfort through behavior, holding head, rubbing stomach, banging head, pulling ear. Especially in cases where the person does not use traditional communication methods, such as someone who has limited verbal communication, it is important to cue into body language and behavior to rule out and/or address physical issues. Your responsibility. 1. Know the individuals that you support so you will notice anything unusual. 2. Be observant. 3. Ask questions. 4. Report what you have seen according to your agency policy. 5. Offer whatever assistance you can as per agency policy, prescription, and/or medical advice. Types of symptoms. There are 3 types of symptoms that we must look for. 1. Objective symptoms. 2. Subjective symptoms. 3. Behavioral changes. Objective symptoms are physical symptoms which are clearly seen. These symptoms are easy to observe and document. Some examples include cough, rash, limping. Subjective symptoms are physical symptoms which are only experienced by the individual. These symptoms are harder to observe because we each experience and express pain differently. Some examples include pain, dizziness, spots before the eyes. We have to look at the actions of the person and ask questions. Some examples of actions include holding onto a chair to get up because the person has arthritis in the knees, squinting at bright lights because the person has a headache. Behavioral changes are changes in an individual's typical behavior which are observable. Some examples include excessive talking, irritability, outbursts, changes in eating habits, unusually quiet. Reporting. Reporting changes to agency. We must always report any changes in physical or behavioral signs, both verbally and in writing. Who we report it to and how we document it will depend on the situation and your agency. Document. Regardless of the way that your agency collects information, case notes, critical logs, etc., the information you will document remains the same. Write only what you see or what someone says to you. It is important to be as specific and as objective as possible. If you believe you know the reason for the symptoms based on your interpretation of body language or history with the person, be sure to write that it is your opinion. We should not write any information as a fact that is actually our opinion or feelings about the situation. Report changes to medical professionals. Physical and behavioral changes are often hard to interpret because there can be many reasons for the same symptom. Diagnosis, interpretation, and treatment are the responsibility of a medical professional. Your responsibility is to consistently observe, report, and document any changes according to your agency's policies and procedures, including calling 911 for life-threatening emergencies per Danielle's Law. Medication considerations, environmental issues, coping skills, medication issues. Medication considerations. Before looking for medication to solve the problem, we should consider the following. 1. Environmental issues. There may be an issue with the person's surroundings, a change in the person's home or personal life, or something in the work environment that is causing the issue. Something may be able to be changed environmentally. Rearrange seating, check noise, temperature, activity levels, etc., which would reduce the behavior. Medication considerations. Before looking for medication to solve the problem, we should consider the following. 2. Coping skills. Medications are not complete solutions. Even with a medication, the person still needs to learn how to cope with the stresses of life, either physical or emotional, and how to express feelings. Teaching the person effective ways of coping, such as effective communication, sharing feelings, anger management, breathing techniques, advocating for self, etc., may eliminate any need for medication. Medication considerations. Before looking for medication to solve the problem, we should consider the following. 3. Medication issues. Medications have the potential for unwanted effects, some of them very serious. There are some medications that have risks that are worse than the issue they were designed to treat. Medications are not permanent solutions. Sometimes medications only work for a short period of time. There's also the potential for a person to become resistant to medication over a period of time. Case study. Jen lives with her parents and has just started attending a new day program where she works on social and recreational skills. The table was adapted to fit both Jen and her wheelchair so she could interact easily with her peers, where they engage in competitive games such as playing cards, as well as paint and create other artwork. The first couple of weeks, Jen has been doing well and was participating in all activities. Recently, she has become irritable. She gets upset if she's criticized in any way, and if she makes a mistake, she yells and throws things. The staff have no idea why she has shown such a dramatic change in behavior, so they have decided to meet and discuss what to do. Are there examples of environmental issues for Jen? What are they? Are there examples of coping skills issues for Jen? What are they? Are there examples of medication issues for Jen? What are they? Medication considerations. Whether the person has medication prescribed or not, you need to 1. Find out what is bothering the person. 2. Make whatever changes are possible in the environment to help the person. 3. Teach the person how to communicate what is bothering him or her. 4. Support the person to cope with the situation. It is your responsibility to advocate for the person, so that the misuse and overuse of medication does not occur. If the person is still having difficulty after we have done that work, then we can advocate for a medication to address the problem. We will know that we are now advocating for this because we are looking for the best quality of life possible for the person, not because we wanted an easy answer for ourselves. Medication considerations. Your role. Be objective. Be specific. Advocate. Your role. If you are asked to accompany the person to the doctor's appointment, you must be objective. Provide accurate information to the doctor. Don't over or under dramatize what you have seen. Even if you have been the target of some of the problems, do not say things like, "He's abusive to everyone." You also should not say that everything has been perfect just because you don't want to seem like a complainer. If the person has had some difficult moments, then you must communicate that to the doctor. Be specific. Let the doctor know about any specific changes. For example, if the person has become physically aggressive 3 times in the past month, say that. Do not say that the person has been beating people up all month. Advocate. If you think the person is on too much medication, that their current dose is not working, or the person's quality of life could be improved in some way, talk to your supervisor and the doctor. Make sure that any medication prescribed is in the best interest of the person, not for the staff or because the doctor thinks we are looking for an easy fix. Always look to see if there are any alternatives. 6 rights of medication administration. Right individual, right medication, right dosage, right time, right route, right documentation. 6 rights of medication administration. Each time you administer medication, you need to be sure to have the right individual, right medication, right dosage, right time, right route, right documentation. Compare the medication sheet, the pharmacy label, and the copy of the prescription very carefully. Make sure that they match exactly. Double check them. If they do not match, contact your supervisor immediately. Do not give a medication to an individual when the documentation does not match. Right individual. This process should be a learning experience. To be able to teach, you have to know the individuals and their medication. You should not give medication to individuals that you do not know. Giving medication to the wrong person is dangerous. Medication should be given one-on-one and not part of a group. Right medication. Be sure to check both the name and the strength of the medication. Sometimes a person is prescribed the medication, but with different strengths throughout the day. For example, Depakote 250 milligrams, 500 milligrams. Both name and strength must match what has been prescribed. If an individual tells you that those aren't my meds, step back and look at the medication. See if you can figure out why the person is saying this. Is it a change in the size, shape, or color of one of their routine medications? Is this medication new, so unfamiliar to this individual? Could this be a violation of one of the rights of medication administration? Right medication. Notice if the medication looks different, color, size, shape, etc., from the last time you gave the medication. If it does, stop. Do not administer the medication until you have checked with a designated agency staff for guidance. Never give a medication from another person's container, even if it is the same medication. Right dosage. Carefully measure or count the correct dosage and compare this amount with the pharmacy label and the medication sheet. Right time. Some medications are administered at specific times of the day, for example, a clock time, such as 8 a.m., or an event time, such as after meals, at bedtime, etc. Start administering medications at the time prescribed and continue until the process is done. Medications must be given at the prescribed times unless otherwise authorized by the prescriber. Right time. Medications can be given in the standard window, 1 hour before or 1 hour after the designated medication time, unless otherwise specified by the physician. For example, a medication that's supposed to be given at 8 a.m. can be given between 7 a.m. and 8 a.m. or 8 a.m. and 9 a.m. If it falls outside of this window, contact your designated agency personnel for approval on administer the medication. Usually, the pharmacy or doctor will need to be consulted to ensure it is still safe to give the medication. Right route. When a physician, advanced practice nurse, prescribes a medication, he or she will specify the way it will be taken. This is known as the route. Ear drops in ear, eye drops in eye, etc. Capsules and tablets are usually swallowed, oral route. Ointments are usually applied externally, topical route. The route and body location needs to be included on the prescription. For example, apply cream on top of right foot. It cannot be a general statement. For example, apply to affected area. Right documentation. Once the medication has been successfully administered, you must initial the appropriate box on the medication sheet. Look for the time you administer the medication and compare it to the date of the month in order to find the correct box. Then initial the box. Be sure to write your full signature and initials in the signature box if it's the first time you've administered medication on that medication sheet. Do not initial or sign your name in advance on any medication sheet. Check each of the rights. This procedure is essential each time you administer any medication. Even if an individual is on a medication for a long period of time, there's always a possibility that some change has been ordered that you are unaware of. You must check for all 6 rights each and every time you administer any medication. If any of the 6 rights of medication administration are in doubt, stop. You must check with the appropriate person, for example, supervisor, prescribing person, pharmacist, to resolve any issues before administering the medication.